Good evening. I'm NET News Director Dennis Kellogg. Thanks for joining us on another special episode of Speaking of Nebraska. Governor Pete Ricketts is back to answer your questions during this live town hall, along with Dr. Angela Hulett, the medical director of the Nebraska Biocontainment Unit and an infectious disease specialist at the University of Nebraska Medical Center, and also Felicia Quintana Zinn, who manages contact tracing for the state as deputy director with the Division of Public Health at the Nebraska Department of Health and Human Services. So welcome to you as well. You can join the conversation tonight. Just call us at 800-676-5446 or 402-472-1212. You can also send us an email, news@netnebraska.org. Well, today, Governor Ricketts announced all Nebraska counties, some more than others, will see more loosened restrictions starting on June 1st. Most of these counties have already been operating under some looser measures for the last few weeks and will move into phase 2 next month. The new directed health measures will allow bars to reopen under similar restrictions as restaurants, will increase the limit on public gatherings from 10 people to 25 or 25% of the occupancy for venues like arenas, event centers, and theaters. And statewide, youth and adults can start practices for low or no contact sports, including volleyball and rodeo. So Governor Ricketts, when you make decisions about loosening restrictions, what are the metrics that you're looking at? Is it just hospital capacity, which you mentioned a lot? And is there any part of you at all that is nervous about opening things up and maybe erasing the gains that we've made to this point?
Well, what we do is we, loosen the restrictions, first of all, May 4th for most of the counties in Nebraska. And then we added on some other counties about mid-month, but we really watch the data, and it is around the hospital data. So if you go back over a couple months ago when we were talking to all the public health experts, they said, again, this is a virus, you can't stop it, but you can slow it down enough so that you don't overwhelm the healthcare system, that peak. And we've done that here in Nebraska with the restrictions we put in place. We've taken that speed limit down to 5 miles an hour, so to speak, for our society, and it's worked. All the sacrifices Nebraskans have made, all the restrictions have worked to be able to preserve that healthcare system. And as we loosened up those restrictions at the beginning of May, we wanted a couple weeks to go by to see what would happen, and our hospital systems remained stable. In fact, we saw in most of the state declining numbers of coronavirus patients. The two places we continue to watch is Lincoln, and Lincoln's actually still doing really, really well. Omaha, we're seeing more patients. I think we got, as of yesterday, 134 patients that have coronavirus using up hospital beds. That's out of 1,600 total hospital beds, so not even 10% yet of over all hospital beds. But we do want to keep an eye on that and continue to monitor it. So that's what we'll do, is manage it, and Dr. Antone, our Chief Medical Officer, is reaching out to all those hospitals. So that's what we're doing to be able to do this. And then, again, we're taking this a step at a time as we look at June. So we wanted to make that announcement today so people could start planning. You talked about bars, opening up 50% capacity, just like restaurants, really being under the same restrictions. Venues, so we heard a lot from, say, brides who wanted to plan their wedding reception and reception venues. So they'll be able to operate, but again, under restrictions of 6 people at a table, no buffets, things like that, 6 feet apart between groups. No dancing, nothing, still that close contact kind of stuff. And then the sports, we heard a lot about that as well. But again, limited or no contact sports, so that we're really trying to, again, just take this a step at a time, and then we'll put those in place June 1st. We'll watch that for a couple weeks, and then we'll make further decisions. So we are just taking this slowly, a step at a time, to loosen these restrictions and allow people to return to a more normal life, if not a normal life yet.
So let me follow up a little bit, though. This week, a new Columbia University study shows that the U.S. could have avoided nearly 36,000 deaths if they had those stay-at-home orders and other social distancing restrictions implemented just 1 week earlier. So we talked about this a couple of weeks ago, but now that the state is opening up more, does it give you pause to think about the possible ramifications that could be coming down the line because of this decision?
Well, actually, I would say that if you talk about when we put our restrictions in place, we did do it early. So let's think back to early March, right? We got our first patient March 6th. I actually got briefed on this a little bit before then as when we were taking in the Americans from Wuhan. And we started putting together our plan that we actually declared a state of emergency March 13th. March 16th, we put in the rule about 10 people limit. But even prior to that week, starting March 9th, for example, Fremont schools decided to just go straight to spring break. So they essentially closed down or operate without students. OPS, LPS did similar things, that week or within a week. And just compare this to New York, where New York didn't close schools until March 15th. So we had schools closing March 9th. They closed March 15th. Our state basketball tournament, the boys, operated with families only on March 12th, the same day the Creighton game got canceled at halftime.
Right.
At the Big East tournament in New York, March 12th. So I would say relative to states like New York, we took steps earlier. We did take that step earlier that Columbia is talking about. Now here's the other thing that goes along with all the stuff that we talked about early March with the public health experts, is that if you lock down too soon, people get tired and they start ignoring your restrictions. And they start, stop doing the social distancing and all that. So you've got to try and time it just right. And I think, again, we did time it pretty good here in Nebraska, where we took these restrictions early relative to states like New York, but we also understand that if we continue to have these restrictions in place, you're going to see people rebel. They're going to stop paying attention. They're going to ignore your restrictions. And we don't have enough police to sit on everybody's doorstep, nor do the police want to do this. So we need voluntary compliance. And we need to solicit that help from Nebraskans. And so far, Nebraskans have been great. They've done the things we've asked them to do. They've made sacrifices. But if we stretch that too long and don't start loosening up some of these restrictions, we're going to see people start abandoning those. So what we want to do is find that balance between the restrictions we want people to continue to pay attention to, still limiting the size of large gatherings, which is really kind of the key here, right? Mm-hmm. Loosen some of those restrictions so we continue to get that compliance, that voluntary compliance from people, and that they don't just wholesale abandon us. And again, we've seen some of these kind of mini rebellions in other states where they have locked down and been more restrictive.
Dr. Angela Hulett, the governor talks a lot about hospital capacity playing a big part in the decisions that he makes. You're working with COVID-19 patients on a daily basis. How comfortable are you with the hospital capacity you see at UNMC and other hospitals in the state as we begin to open up more? Do we have enough ICU beds? Do we have enough ventilators? And do we have enough staff to treat patients, especially if we see a spike?
Well, I think hospital capacity is an important factor in this, and I agree. I mean, looking across the state, looking at the number of beds, the number of ICU beds, the number of ventilators available is a really important thing to follow. Early on, we were very concerned about our rural areas. As we know, we were seeing a big spike in those areas, mostly due to the meatpacking industry and other things, where we were really stretched in those small hospitals as far as capacity goes. And Douglas County really, at that time, had not seen a huge number of cases of COVID-19. And so we were doing okay, up until, I would say, a couple of weeks ago is when we really started seeing our caseload increase, which is not surprising. We're the largest, obviously the most populated county in the state. Over the last couple of weeks, though, we've definitely seen an increase in cases, and particularly at the Med Center, the number of cases we had even 2 weeks ago or 10 days ago compared to now, we just keep building. And I guess, right now the Med Center is at 80% capacity for our ICUs, for our hospital beds, which is pretty significant. Most of those patients are not COVID-19 patients, but the other issue is that there were a lot of patients who are regular patients who were out there, and this has been a trend across the country, who were sort of sitting at home when they were getting sicker. And these are our regular patients, our patients with heart disease and lung disease and things like that. And so now we've seen some of those patients coming back into our system, which is important because we obviously need to take care of those patients with chronic medical problems as well. But on top of that, then we have about 50 patients with COVID at the Med Center as well. And so that's what's contributing to our build. The patients with COVID, when they come in, are very, very sick, obviously, in order to meet our criteria for hospitalization, and they often require ICU care. About half of our patients are on ventilators now, about 50% of our patients. And when they go on a ventilator, they stay on for a long period of time, typically, 3 weeks, 4 weeks, sometimes longer. And so that's the thing I'm worried about more. It's not a big surge or an influx. It's more this gradual building that we've been seeing, over the last couple of weeks. And I anticipate that may continue. And again, we're seeing our regular patients as well in the hospital. So we really need to watch that, and especially in the Omaha metro area. As you mentioned, that is an area that, that we obviously have a lot of hospital capacity still, but we just need to be really careful about, maintaining that.
You talked a little bit about the people from rural Nebraska, and you're probably treating some of those as well. How important is it for people in less populated areas to still observe these restrictions? If I'm around fewer people, does that mean I have less of a chance of getting COVID-19?
Well, the fewer people you're around, you definitely have a lessened chance. And that's the reason these restrictions are in place, to keep the number of people down. And so this virus doesn't care. It doesn't care about where you live. It doesn't care whether you live in a rural area or an urban area. What it cares about is a group of people, and that's how it's passed around. And so what even folks in rural areas need to be very careful about this. What we don't want to see is another surge, that we saw in the beginning of this in those rural areas, which also not only puts stress on the hospitals in those areas, but also the hospitals in Douglas County and Lancaster County as well, who often take care of patients from the smaller communities. So we need to be very careful about what we're doing, both not only in our metro area, but in our rural areas as well.
Deputy Director Quintana Zinn, Governor Ricketts has set a goal of training 1,000 contact tracers to do the critical work of finding Nebraskans who have been exposed to the virus so they can self-isolate and prevent further spread. How close are we to reaching that goal of 1,000 contact tracers?
So right now we have about 330 contact tracers trained already, so about a third. So we've been able to really ramp that up. We are working with several different companies to really help build that even further. And so over the next coming weeks, we're going to be working more and more to really hit that goal and to make sure that we have enough capacity when it comes to contact tracing. So that way, if we do experience another surge or spike or anything like that, we have that manpower that's able to reach these individuals as quickly as possible to really get that advice out to them, let them know, hey, this is what you need to do, ask them who their contacts were, so that way we know who else we need to keep a close eye on too.
What skills do you look for in a contact tracer? And if somebody's out there saying, I think I can do that, what's the next step for them? What should they do?
Yeah. So really, our goal right now is to work with companies that have staff that are experienced with healthcare and have good conversational skills with people. So there are a couple of different skill sets that are there. We really are looking for groups and people that have some healthcare backgrounds, whether that's maybe, I don't know, not necessarily insurance, but maybe talking about dental health or something like that with people. So really understanding kind of just some general medical terms, but then also really the biggest piece of that is just communicating with people and really helping them understand kind of what's going on, what they need to do next. Those are the key skills that we're looking for.
If I could also just build upon that a little bit. As we talk about loosening restrictions, we're in a much better place today than we were just even a few weeks ago. There's a number of tools that we use to fight the virus, and this contact tracing is a big, important one that Teresa was talking about. The first thing is testing, so ramp up testing. And over the last week, we've done about 22,200 tests versus 13,300 tests the week before that. So testing is ramping up. Then the contact tracing, to be able to follow up with those people and get people who test positive to isolate, keep them away from everybody else so they don't infect people, right? And then contact the people they've been associated with to figure out how close a contact that has been. Maybe they need to monitor their symptoms, maybe they need to quarantine. And then also the other things we really are focused on is quarantine space. We're working with UNO, UNL, UNK to find places for people to quarantine if they can't do it at home. PPE, having a 90-day supply on hand so that we can provide that to healthcare providers and first responders. And we've got a strong position right now with that 90-day supply on hand. And then some of the other things we're doing with regard to how we're working on plans with like long-term care facilities or the guidance documents we put out. All those things are tools that are much better developed today than even just a few weeks ago, because we've had that time, because we've slowed things down with these restrictions. We've had the time to be able to build these things up.
Are you happy, though, with the progress we're making in getting more contact tracers?
Well, I would certainly like to have more, Felicia. But actually, we were able to train up a bunch of our teammates at DHHS. So of the 330 or so Felicia's talking about, like 267 of them are our teammates who in different departments. And so we're using those folks kind of in a short term to get these companies ramped up. And then ultimately, we want to find a company or companies that get us to 1,000. Yep. So, I'm feeling good about how much we've made. I want to see faster progress. I want to see more progress. But it is tremendously helpful to have these folks. Just to put it in perspective, if you think about it, this was really done before with local public health departments. And I don't know what Felicia, 3 people, maybe a dozen, right?
Around the state total, we're looking at 30 is typical for just our normal surveillance.
Across all public health districts.
Across all public health. So that's our statewide. That's what we're usually looking at. So the fact that we're 11 times more already is quite a bit of progress, and that's on top of the local health departments and all the staff and work that they have done as well.
Governor, a question from Laura in Omaha, and we just talked about hospital capacity, and that's what this has to do with as well. Please elaborate on why you feel it's an appropriate and safe time to relax the DHMs in Omaha when our hospital capacity is already increasing to a point where it's becoming a concern. If hospitals barely have the staff to treat the patients they have now, how do you think they will treat the additional patients that start being admitted once they are given more freedom to move about and be in public under your new DHMs for June?
Yeah, so this gets back into striking that right balance. So for example, if you look at what we've done with regard to the restrictions we loosened up in early May, we saw that the hospital systems by and large stayed pretty stable. In fact, actually, if you look at our rolling 3-day average of case counts, you can go look at it at our website, you'll see just eyeballing it, you can see that we're on the downward slide on that. Now, it's still something we have to manage. So to Dr. Hewlett's point, we've got to keep an eye on it, we've got to manage it. We'll work with hospitals individually. We may ask them to change some of the things that they're doing to be able to make sure that we've got the capacity to handle folks. But again, if you're just, keeping this in perspective, for example, in Douglas County, we've got 311 ventilators. 44 of them are being used by coronavirus patients. So a lot of this is not specifically around coronavirus. It's about some of the other patients Dr. Hewlett was talking about. We also have to take care of them too, but this is all something that, working with the hospitals, we can manage to be able to do this. And again, the longer we stay locked down, the more likelihood people are just going to abandon what we're doing already. So we've got to kind of strike that balance to allow some loosening, to give people some more opportunity so that they stay with us for all the other things we're asking about. Again, we want to limit the size of those large groups. When we first started having these conversations, we were talking about sizes of 10 or 20 people. Well, our DHM is still going from 10 to 25. It's still not, in many ways, ramping up hugely. So we want to just find that right balance.
Dr. Hewlett, you, as we mentioned, treat a lot of COVID-19 patients. Can you talk about the symptoms that you see? What do you see as the biggest difference between those who recover and those who don't recover?
Well, so this disease is interesting, and I will say, obviously, this is a new disease, and so we're learning every day, about the clinical presentation and also how best to manage these patients. Initially, most of the patients that we see start with a week or so of symptoms. Sometimes that's a cough, sometimes that's a fever. It's highly variable. I'll tell you though, we have patients who have very, very mild symptoms akin to allergies or something that they would kind of normally attribute, to this time of year. And then we have patients that have, much more severe disease and go on to develop critical illness. So typically, again, starting with a cough, usually fever, but not always. Sometimes, feeling short of breath is a warning sign, and that's something that over the course of that initial week, sometimes people start to develop, I'm feeling a little more short of breath, my cough is worse, I'm feeling worse than I was before. And that's when we start to see patients present not only for medical care, but also for hospitalization. And so when patients come to our emergency department, if they're experiencing that shortness of breath and their oxygen levels are low and we see those warning signs, then we do admit these patients to the hospital. And when they come in the hospital, then we monitor them very closely. We watch all of those parameters. And unfortunately, some of those patients, and as I said, half of our patients now are on ventilators, they progress into really needing that extra support and that respiratory, care and support through mechanical ventilation. Some don't. Some go on to do okay and maybe require a bit of oxygen and then eventually are discharged and go home. But what I worry about is just the fact that this illness seems to cause a lot of severe disease. And we see patients with influenza with severe disease. There are lots of other viruses that can cause severe disease. But this one in particular, when you get sick from this, you get really sick. And most people, we think it's probably 80% or more, have a really mild illness and may not even know they have it. We do know that there's a high number of people that are asymptomatic and have no symptoms at all throughout this, which makes it a bit scary to think about some of the things that, that we're talking about. And I think that's the reason we really have to be careful, in doing the things that you're recommending, making sure that we're still exercising caution in public, making sure we're doing all those things,
6 feet
hand
of
washing,
distance.
6 feet of distance. Yeah, exactly. I mean, wearing our mask in public, trying to protect each other and protect ourselves. All those things still need to be in place, because this disease is something like I've never seen before, and it's definitely a scary one.
Following up on that, Governor, a question for you from Rachel. She says, we know that wearing masks in public helps slow the spread. Why isn't Governor Ricketts encouraging everyone to wear a mask in public? I think you have encouraged them, you're just not mandating it.
Yeah, we're not mandating it. Well, actually, we are mandating it in certain circumstances. So, for example, in the DHM, our directed health measure for salons, barbershops, tattoo parlors, and massage therapy, we specifically say, in the DHM, you have to wear a mask both as the patron and as the stylist, for example. And I'm guessing Rachel doesn't watch my press conferences, because just today we were talking about it both in the English version and the Spanish version, talking about the importance of wearing masks when you go out in public, going to the store. As we open up some of these venues like movie theaters and stuff like that, if you're going to go to that, even though we've got social distancing in there too, 6 feet difference between parties, and it's still a good idea to wear a mask. So we do want to tell people that, but to your point, we've mandated specifically for things where you've got that close contact, like in a salon, you can't be 6 feet away to cut somebody's hair, so you got to wear the mask there. But in other situations where you can be that social distancing, it's still a good idea to wear a mask. Like, go to the store, wear a mask. When I went to go get my wife some, a bottle of wine for her birthday, I wore a mask into the store because I don't normally go there, right? So, but you got to, use common sense and good judgment when you're going to be out in public in places like stores or some of the things we're talking about. Keep 6 feet apart, wear a mask.
Actually, it's probably more important to wear the mask as you loosen the restrictions than even it was with the restrictions in place.
Yeah.
Yeah. Well, last week we looked at the number of new cases in Nebraska each week and asked if the state had reached its COVID-19 peak yet. With another week of data confirmed, the decline in cases statewide has continued, as we've talked about. Last week, the state confirmed just under 2,000 new cases compared to about 3,200 new cases the week before. So far this week, about 1,200 cases have been confirmed, and the state is on track to complete this week with fewer new cases than the last 2 weeks. But the percentage of tests per day that are positive for COVID-19 is still higher than health officials want to see. So far this week, a little over 9% of tests have been positive, a slight improvement over last week and half the positivity rate of 2 weeks ago. So, Dr. Hewlett, how do experts determine whether an area has reached its peak, and do you think Nebraska is there yet?
That's a difficult question. I'm going to tell you, even for an epidemiologist. No, it's difficult because I really feel like that we're not. If we look at this on a state level, we see some numbers, and again, I agree. It does look like that things are a bit, leveling out a bit, which is good to see. That being said, this seems like a lot of little outbreaks, and so again, we saw outbreaks in the rural communities. In Grand Island, was a big hotspot. Even what was that, a couple weeks ago? I feel like the weeks are running together, but it wasn't too long ago when Grand Island was really seeing a lot of cases and in the surrounding areas. And yet now we're seeing those cases shift into Douglas County instead. And so we're seeing more cases in our, local kind of metro area in Douglas County. And so I do believe that this is a group of small outbreaks put together. I do think that, again, it's encouraging that we're seeing those numbers throughout the state. The fact that we're having more testing is incredibly important in this, and the contact tracing is also a very important part of making sure that what we're seeing is really what's happening. And so I feel like that, we have to be, again, very cautious, and particularly in Douglas County, because although we're seeing cases decrease in certain parts of the state, we're still seeing an uptick in cases, in certain areas, and in particular in certain populations in Douglas County.
And should we expect spikes along the way? I mean, is the curve just not going to continue to go down? We are going to see some spikes?
Yeah, it's just an imperfect thing. So I don't believe that we're going to see a big surge. Now, there are places that saw that. New York City is a good example. Saw a huge surge, and Detroit, another good example. A giant surge in cases, and then have since seen their cases gone down. Ours our curve hasn't really looked like that, which is good. I'm glad that we didn't have this huge surge in cases and overwhelm our system. But what we've seen is more a gradual increase, maybe a potential leveling off, but there definitely could be blips in there. And so we could see an increase in cases, over the next couple of weeks. Some of the relaxation that occurred a couple of weeks ago with the directed health measures. This disease, the way that it works is it can be up to 14 days incubation, and then people do have a relatively mild disease for a week or so. And so we may start to see some effect of that even in the coming week or so, a couple of weeks. And it all depends on how people behave out in public. I really feel like if they're doing things that are recommended, as you mentioned, all of the things that, gathering in smaller groups, wearing masks, being, very cognizant of, that human-to-human interaction and how this virus is passed on, then we'll do okay. And I hope that's the case. I really hope that we won't see any more blips. I hope that we'll continue to see maybe a leveling off and potentially then, a decreasing number of cases, but only time will tell.
And of course, as you said, contact tracing is part of keeping that community spread down. So Deputy Director Quintana Zen, walk us through exactly what happens when someone gets a call from a contact tracer. What kind of questions can they expect to be asked?
So everything pretty much starts with that positive test result. So that's really where it all kind of starts. And so there's two kind of segments to it, I'll say. So the first is for the actual case. So the person who has tested positive, they're going to get asked some questions. They'll get a phone call. Usually it's pretty quick. Our goal is to really get to that person, give them a call as soon as we can. Usually that's within a day or two. And really the goal is to ask them kind of, one, get some information from them, some just basic general information. We want to know kind of some of that basic demographics, like what age groups they're in, things like that. That also helps us with just understanding this virus a little bit more and kind of how it affects people over time. But then also we want to know kind of what symptoms you had, what that looks like, what the severity of your symptoms. Have you been hospitalized? Have you not? So that's kind of the start of it. And then the next kind of questions that get asked are, what were your interactions with people? What did you do from 48 hours before you started feeling symptoms or before you got your test, moving on? And so really identifying those close contacts. So when you've been within 6 feet of somebody for more than 10 minutes, if neither of you have had a mask on, things like that, we really try and understand what that interaction looked like. So that also helps us understand who else is at risk, whether it's high risk or low risk, and that helps us reach out to those individuals that have been exposed and let them know what they need to do next.
And what is it that they have to do next if you find out I have come into contact with somebody with COVID-19? What's the next step?
Really, quarantine or isolation is going to be your biggest thing. So if you're already sick, you have symptoms, that's isolation. If you're been exposed but you haven't had any symptoms yet, then that's quarantine. So for those individuals, it's really discussing what that looks like, really separating yourself from other individuals, even within your household, to really try and minimize how much risk you could pose to your family members or those other people in your house, but then also just to the general community as well.
And then also, don't we do follow-up calls as well?
Yes.
To say, hey, because we ask somebody to quarantine. Okay, so then we call and follow up. Okay, are you quarantining? Are you staying home? That kind of thing. Check on them, yeah, exactly. Remind them they're supposed to be doing that.
Right. Yeah. Well, the number of tests per day throughout the state has been increasing, but has still not reached at least 3,000 per day, the level public health experts say we need to reach. So, Governor, you're encouraging Nebraskans to complete the online assessment at testnebraska.com, but we've heard from several people who say they are approved to get a test, but the time slots fill up too quickly. Here's Kyle from Omaha.
Hi, my name is Kyle Hansen from Omaha, and immediately prior to filming this question, I had tried to find testing times available throughout Omaha. I was unable to find any through Test Nebraska and found it extremely difficult to find testing outside of the Test Nebraska system as well. Given the increase in COVID cases in the Omaha area, When will testing go beyond rationing and word of mouth to find good tests?
And Governor, we also want to point out that Mary Sue in Omaha also told us she qualifies for testing, but at least twice has tried to schedule a test and all the time slots are filled. So what's preventing Test Nebraska from opening up more time slots and reaching the goal of 3,000 tests per day?
So we are still working on, again, setting up our mobile teams. So we've got 4 teams. We're going to be going to 6 teams as we continue to expand the testing. And I would say to the folks that are there, keep trying. Right? And if you look at the people who have signed up, a lot of them are in the Omaha area. And so we want to make sure we're doing a lot of testing in the Omaha area. It's our largest metropolitan area. But we also need to make sure we're looking at other parts of the state as well. So for example, next week we are going to be in places like Seward and Beatrice and Clay Center and so forth. So we do have to move the mobile teams around. And in addition to the Test Nebraska, we do have teams, for example, set up to do testing at One World. Charles Drew is doing testing. We've got testing on 24th and Cumming, and so we've got other testing sites looking out. So we're continuing to look at expanding Test Nebraska. So we're getting that system in place and ramping that up. And then we're going to continue to look for other ways to expand testing as well. So whether it's through additional commercial labs or more commercial lab capacity to be able to do that, or finding other ways to be able to expand our capacity, we want to continue to be able to do that, and we're going to invest in expanding that testing. So I'd say to the folks who've signed up for testnebraska.com, I mean, good problem to have, right? That we know there's demand for it, people want to do it. Please keep trying back. When you check in every day with that email, we're going to be around the Omaha area, for the foreseeable future. So just keep trying, and we'll keep looking, keep opening up spots, and so keep trying to get in.
All right. We want to remind you that this is a special episode of Speaking of Nebraska with Governor Pete Ricketts, Dr. Angela Hulett, Medical Director of the Nebraska Biocontainment Unit, and Felicia Quintana Zinn of Nebraska DHHS, who manages contact tracing for the state. You can give us a call, 800-676-5446 or 402-472-1212. You can also send us questions on social media. Find us on Facebook and Twitter at NET News Nebraska. Well, a poll released this week from NPR, PBS NewsHour, and Marist found that a large majority of Nebraskans are worried about COVID-19 in the future. As states reopen, 77% of American adults say they're concerned or very concerned about a second wave of the coronavirus. That concern is slightly higher in the Midwest, with 79% of adults expressing concern, and slightly lower in rural areas with 69%. A lot of questions submitted to us express fear and anxiety about opening too soon. Others tell us the ongoing restrictions are increasingly frustrating. So, Governor, when you make plans for the near future, like loosening restrictions, how much thought about governing what could be happening 6 or 8 months from now goes into that? And what's the long-term strategy to prevent a second wave? And again, who are you talking to? Who are you listening to develop that strategy?
Yeah, so, well, first of all, I'd say that we're still working on ramping up the resources that we want to have to respond to what's going on right now. So we talked about the contact tracing. We're a third of the way there, but we want to get to 1,000. You talked about getting up to that 3,000 tests per day. We're making progress. There are days we've hit 5,000 tests per day, but we're not there on a consistent basis, and we got to get there with things like testnebraska.com and expanding other testing capacity. So a lot of our focus right now is still on reaching our short-term goals with regard to things like testing and contact tracing. We've started to have conversations about what would a second wave look like, why would that happen. A lot of people have talked about it happening in the fall, and so we're just really starting to have those conversations about what we do. But I think the important thing is, look, as we ramp up this testing capacity and we ramp up contact tracing and we have the quarantine space and we have the PPE, when and if there is a second wave, then we will be much better prepared at that point than we are now. And so the idea will be, if we start seeing that there's some sort of second wave for whatever reason, we jump on it quickly. We get the have that testing where we're kind of out there going on with ongoing testing to be able to kind of spot it early, and then get the contact tracing there so we can really do robust contact tracing, get people to stay home if they're demonstrated to have tests or if they need to be quarantined. And that's how we really kind of nip it in the bud through that. The standard practice of doing the contact tracing is something that epidemiologists use forever. It's a tool that's well proven. And so we've got the ability to ramp up to be able to respond quickly. And I think that's really going to be our best defense against a second wave until there's a vaccination. And while I think there's some positive news out about vaccinations, at the end of the day, we got to remember there may not be a vaccination. So we may be managing this for the rest of the year or forever, right? And which means that, again, the robust testing and contact tracing is going to be our best line of defense if there's not a vaccination.
And who are the people who really have your ear? When you have to make a decision, who are you turning to?
Well, we actually have daily calls with the folks at UNMC, people like Dr. James Lawler, Dr. Cradaville, Dr. Gold. So we're talking to them. We're talking to our local public health officials with regard to the DHMs and everything like that. So we have a lot of conversations. And actually, as we're talking about loosening up restrictions, we're having conversations with the industry, the people that are going to be impacted by this, to find out, what can you live with, or that sort of thing. What would be the best way to implement a restriction or a DHM, so we can get feedback from them as well, helping them understand what our goals are with regard to limiting crowd sizes and that sort of thing.
Dr. Hewlett, a question for you from Susie. What is the rate of patients in the hospital with COVID who came in with underlying health conditions?
Yeah, so that's a great question. We have looked at that some. The vast majority of people that we're seeing with severe disease, so severe enough to be hospitalized, do have an underlying condition. That being said, it could be something as simple as high blood pressure, which is, a very common underlying condition that many of us have. But we do see, we see individuals that are very sick, that have lots of different health problems, cancer patients, transplant patients, that sort of thing. But then we've definitely seen some otherwise young and healthy people who really don't have any underlying conditions, who still require hospitalization and often get very ill. And so this virus definitely can affect the individuals that are older or have multiple medical problems. That is by far, what we've seen at UNMC, as well as, across the United States and the world. But that being said, it definitely can affect younger people too. And so I want to make sure that everybody understands that what we've seen is, again, the older population getting the sickest, and that's true. But this can affect young people. And so just because you're otherwise young and healthy does not mean that this will,
Still wear a mask.
Still wear a mask and wear your mask, that's to protect other people. So just because you're young and healthy also, you could still be shedding this virus, be completely asymptomatic from it, and be passing this on. And so I want people to understand that when they're in the grocery store, when they're out, doing things, that it's important to try to protect others by wearing your mask. We've shown that wearing a mask in itself does provide some degree of protection to the wearer, but what it really does is it stops those secretions from being spread out in the environment, especially for those people that don't have any symptoms. And there have been lots of cases of this throughout, the United States and the world, where we've seen churches who have, a church service resulting in multiple cases, over, I think, 35 cases in Alabama in a church service. And a couple deaths actually that resulted from an asymptomatic individual. There have been cases in exercise establishments in other parts of the world where they had a exercise class that resulted in lots of cases. So people were, were around each other in close contact, and so those types of things are really scary. And what we really need to do is try to protect each other. And so the best way to do that is to try to stop those secretions. And again, you don't have to have symptoms in order to spread this around. And I think that's an important message to get out. So even if you're young and healthy, try to protect others,
Yeah, and granted, this was just one case, so you always got to be careful about drawing a lot of conclusions from one case. But we saw with one of the food processing plants, they had done a lot of testing everybody in the plant, and about 14% of the people came back positive.
Right.
75% of those people had no symptoms.
Right. Right. So that's the scariest part of this. And I will say that's what differentiates this virus from a lot of other viruses. In particular, we know a lot about influenza. We know that for the first day, probably 24, 48 hours before you develop symptoms, there's a period where you can not have any symptoms and you can spread influenza around. This one is much more dramatic than that. This is, a fair degree of individuals, and some of those even result in these what we call super spreader events, where you have somebody who has no symptoms at all and yet can spread this virus throughout, especially in close contact. And so that's the scariest part of this virus. And I feel like that people need to be aware of that. And, there are a lot of us, myself included, who early on in this did not recommend the wearing of masks, because we've never really seen anything like that in this country. Even during H1N1, we weren't wearing masks routinely. But we've learned so much about this virus since that time in January, February. And I'll tell you now, it's time to be wearing masks in public right now, to try to protect other people, and especially those people that are our most vulnerable.
Deputy Director Quintana Zinn, a question for you that has come in from Rachel. How many bilingual contact tracers do we have in Nebraska?
I don't have that number off the top of my head, but bilingual contact tracers is something that we're definitely working on increasing, making sure We're also working on making sure that we have multiple languages available so that if you're Somali or Sudanese, or if you speak Spanish or Yiddish, whatever that language is that you might speak, and that's kind of your most comfortable way to communicate, we want to be able to communicate with you as well. And so we're working to make sure that we're increasing the number of people that are bilingual, but also we have services for interpretation and making sure that we're able to communicate with those different populations.
I think the first company we hired, PRC out of
Yes.
Omaha, an Omaha company, of the about 40 people that they were providing us initially, about 20 of them actually were bilingual. So I know we had at least 20 there. I know a lot of our DHHS
Yeah, and we had
teammates
some DHHS.
that we pulled over for this were bilingual as well. I don't have the number off the top of my
Yeah.
head either on that one, but I just remember PRC, since we just recently hired them and got them trained, a week ago or whatever it was, and about half the staff that they were providing were bilingual.
This question I want to start with you, Governor. 7 inmates from the Community Correction Center in Omaha have tested positive for COVID-19. So what's being done to deal with that particular situation? And then I know contact tracing is part of it, so then I want to follow up with you about how you do that in a confined situation like that. But talk about that situation.
Yeah, so we've had a plan in place for corrections. Actually, they've had emergency plans for a long time. Updated those plans actually at the beginning of this when we started getting briefed on it. And really, the inmates get treated just like general members of the public. So when we have somebody who is identified, tested positive, then we isolate that person. We've got facilities available in corrections to be able to do that. We do the contact tracing just like we would for a general member of the public, and we do the quarantining as appropriate for close contacts with those people, and so forth. So really, the process is very similar to what happens in other places. Now, obviously, in corrections, it's a little bit more challenging to be able to do some of the social distancing sometimes, but that's part of the plan that Director Frakes has put together with regard to making sure we've got that space to be able to have people be separated from the other inmates so that they're not spreading it.
And how does that work in a confined situation like that?
Yeah, so it's actually it looks very, very similar, just like Governor Ricketts said. And one of the pieces that's also really helpful is a lot of these facilities have put plans in place ahead of time, and so they've been doing screening measures and documenting if any of their staff or anybody is having signs and symptoms. And so they've had this heightened awareness. And so those different pieces that they've put into place have really helped speed up that contact tracing and really identifying other people who are at risk. And so a lot of these, if we're talking about corrections or different facilities, they have some, there's different tools and things that they've been able to put in place prior to even having any cases that they've been doing for weeks or even months for some places, to really make sure that if there was a case, we can get in there pretty quickly and help isolate those individuals who would be sick or quarantine those who are exposed.
Governor, I want to ask you a question that came in from Gary from Omaha. He says he supported your efforts during this mess we are in. However, disappointed in your response in the last few days when asked about the validity of reporting COVID deaths. He says you sidestepped the answer by saying it's up to the doctor to determine what the cause of death was. He says you should be transparent and at least show actual deaths from the virus side by side with deaths not caused by the virus but may be present. How would you answer that?
Well, again, Gary, I'm sorry you feel that way, because really there are guidelines out there with regard to how doctors are supposed to be treating this. So they're nationally established guidelines. At the end of the day, it is the doctor's decision about what the cause of death is. I'm not the doctor, I'm not the person who's familiar with the cases, so it really needs to be that doctor or that medical examiner who is making that call with regard to, was it somebody who died directly because of coronavirus, or did they just die with coronavirus? So it really is up to the physician or the medical examiner to make that. It's not really my call to be able to do that. And again, what we focus on with regard to how we're managing this is really getting back to looking at the hospital capacity, and that's where we're focusing our attention, not so much on the fatalities with this. So, again, I'm sorry I'm coming out like it's the same answer I gave you earlier, and that it sounds like sidestepping, but it really is the doctor's call to make that. And I think that all of our public health professionals would be very nervous about anybody else besides that doctor or medical examiner trying to intervene and tell the doctor or the medical examiner what they should be doing.
Question comes in tonight from Connie. What rights do long-term care residents have in this quarantine? Many families pay between $8,000 and $10,000 a month for their loved ones to be there. Many feel like they're paying for their family member to be a prisoner. When will families be given the right to go visit?
Well, and again, we know this is a tough time for the families and the residents of long-term care facilities. And really getting back to what Dr. Hewlett was talking about, older people with underlying health conditions are really at risk, and we know that. And so they have been isolated for the last couple months to be able to try and keep them away from the virus so that we don't have that infection. We've been working, actually, one of the things we've got here in Nebraska, we've got our ICAP team. It's our Infection Control Assessment and Promotion Program that works with long-term care facilities and has for the last 4.5 years to be able to put things in place to control infections. They've stepped up their efforts with regard to training. They're doing site visits to facilities to be able to help facilities do a better job on the infection control. And one of the things we announced last Friday is we've asked every long-term care facility to start working on a plan to return to us to how they're going to manage this virus for the rest of the year. And taking into consideration that plan, how are you going to allow for family visits? What are you going to do? How is that going to look? Because again, we still want to keep the folks, the residents there, away from the virus. So how are we going to do that and still let them see their family members? Because we know that's important for the family members, it's important for the residents. And playing into that is the mental health aspect of this too. So that needs to be part of the plan too. What are you going to do for the mental health aspects? And of course that, like I said, dovetails into seeing family members. So we know this is a tough time for folks. It's just a tough situation. But we are working with the facilities. We are going to have them put together plans. And again, as we get further into this, hopefully we'll be able to see some creative solutions with regard to how family members will be able to interact with their loved ones.
And we did have a question that came in. What's the deadline for that plan, and will those plans be made public?
So what we're working right now with the industry to establish the template, and the deadline for that is tomorrow. And then we'll use next week to kind of put together those templates and send them out. And Felicia, off the top of my head, I can't remember what we were talking about for a deadline. Do you remember off the top of your head?
I don't remember off the top of my head right now.
I don't remember off the top of my head,
Yeah.
but it'll be soon as far as getting those templates out and then having those facilities start responding back with their plans. And just to be clear, all these facilities already have emergency plans already. Okay, so that was already in place. And this is, again, part of the ICAP program that's been going on for years. What this is just another, okay, now we know more about what you're dealing with. It's not just a generic emergency. It's a coronavirus that you're going to be managing probably through the end of the year. What are you going to do to be able to allow family members to be able to interact with their loved ones? What are you going to do about the mental health, as well as all the other things with regard to how are you going to improve your infection control?
Dr. Hewlett, I want to ask you about the drugs that are out there that we start to hear about, the development of a vaccine. We're hearing something this week about Moderna, which is more of a vaccine-oriented type of drug. And then you also have treatment drugs like remdesivir, which UNMC was involved in that trial. How do you feel about it? Are you seeing anything that's really positive out there?
Well, so in the beginning of this, we obviously had nothing. And so people were really kind of grasping, trying, to find a drug that worked. The best way to do that is through our participation in trials. And so we've now had drug trials that have come out with some reasonable data so far. We've definitely disproven a few that we were using initially, that a lot of people were using, out of desperation at first. We've also shown that there's one, in particular remdesivir, that does seem to be promising. Now, it's not a miracle drug in any way. This drug did seem to decrease the length of hospitalization in patients, which is actually a very important metric. So it seemed to be making patients better faster and to get home faster. That being said, as I said, it's not a magic bullet yet, and we really don't have one of those yet. We're hoping to find one. There are lots of trials underway, both in the United States and throughout the world. The good and bad news is the fact that we have lots of cases to study. When we had our outbreak of Ebola in Africa in 2014, by the time we really got those drug trials going, the cases had started to decrease, which is a wonderful thing, but then you really don't get that data to try to actually study and figure out what works. The fortunate part of having lots of cases, if there is one, and I would say that's the only fortunate part, is the fact that we will be able to hopefully tell which one of these drugs is successful and which one can really help people. And similar with a vaccine, there are vaccine trials underway. There are many vaccine candidates out there. We obviously need to study a vaccine looking at not only is it safe, which is incredibly important, but does it work? Does it actually produce immunity, and that sustained immunity that we really want in order to try to rid ourselves of this illness?
You spent a lot of time dealing with patients that had Ebola back in 2014, and you also treated the patients off the Diamond Princess cruise ship. Are you seeing any kind of similarities between what went on 6 years ago and what you're dealing with right now?
Well, so these are both virus disease. They're very different, I will say. The difference is that Ebola virus was transmitted in a completely different way. You really had to be pretty up close and personal with people, contact with blood, body fluids, that sort of thing, in order to actually transmit Ebola. But it was a scary disease. It has a high mortality rate, very kind of difficult to deal with from an infection control perspective. But this one is also scary in its own way, just in the transmissibility. We really haven't seen anything like this, and the amount of the ability to transmit this virus doesn't really take much. And so it's very contagious. One sick person in a room can infect lots of people, and that's been shown in multiple different venues. And so that's the scary part of this disease. So Ebola was its own scary disease, and we learned a lot from our infection control endeavors and things like that, caring for our Ebola patients. But this is transmitted in a completely different way, and it definitely produces a lot of challenges.
Deputy Director Quintana Zinn, we have a question from Stapleton. Should we be keeping a journal of where we are going in case there's an outbreak and contact tracing is needed?
That's a hard one to say. I mean, really knowing kind of where you've been over a period of time is going to be important. But I don't necessarily know if you need to go to keeping a journal and going that far. But if that's what makes you comfortable and you want to go in that direction, then it's something that I would say each person needs to make that decision for themselves. But really just understanding kind of if your normal habits, if you're if you're self-quarantining yourself, or if you're limiting how much you're going out, things like that, you probably don't need to keep a journal because you probably remember, hey, on Wednesday, I went to the grocery store. But if you're going a lot of different places, that would be something where we don't want you traveling that much anyways.
Yeah. Right.
Yeah. So I don't think at this point that's necessary by any means.
What about some of the new technology we're hearing about that can help with contact tracing through location tracking? Are we going to see Nebraska planning to implement any of that or use of that? Is that a personal decision?
I don't know if we're going to be using any of that right now. Really kind of having those conversations and having those discussions with people. It's something that's tried and true. Contact tracing is not new to epidemiologists at all. This is something that dates back to John Snow and the watering pump and those types of things.
Very careful there, Felicia.
Several
Most people know
hundred
John
years.
Snow from...
Yes, several hundred years.
Different John Snow.
Different John Snow.
Not the John Snow from TV, but so this is something that is not new for us. And just like there's investigators in other areas, epidemiologists and people that are disease investigators, this is what they've trained for. They've trained to have those discussions. And so that's something that, we're really working towards.
Governor, I want to ask you a question from Janice from Grand Island. You knew we had to talk about sports at some point.
Sure.
She wants to ask about the youth sports reopening guidelines, specifically the no concession stand directive. She asked, can you explain the thought process there? It seems to me that a concession stand at a complex is no different than a food truck, and if the social distancing spaces are marked 6 feet apart, I don't see why they're not allowed. Many of these youth organizations rely on these funds to run their teams and their programs, so how would you answer that?
Well, I've got good news for Janice.
All right.
Correct me if I'm wrong on this one,
That's right.
Felicia. I think actually we've decided to amend that one to allow concession stands at youth sporting events. So again, everybody's still going to have to do the same thing they're going to have to do with regard to the 6-foot distancing. It's always going to be a good idea to be wearing a mask when you go into those things, but absolutely we've looked at that and working together with the public health directors have decided that we are going to allow those concession stands.
Dr. Hewlett, we have a question about PPE and making sure that the frontline workers have what they need. What are you seeing at UNMC? What are you seeing statewide? Do we have a good supply there?
Well, we've been very fortunate in that we've really come up with some innovative ways to decontaminate our, particularly our N95 mask, which is something that very early on, a group of individuals from UNMC actually were real pioneers actually throughout the United States and the world at figuring out a way where we can reuse these masks. Now, would we rather have new masks? Of course we would, but right now we really want to make sure that we preserve those supplies, which continue to be scarce. Right now we're doing okay. We're able to care for our COVID positive patients, wearing appropriate protective equipment. We have done really well in that, and I'm very proud of what we've done at the Med Center to try to protect our healthcare workers and make sure that everybody stays healthy. We're wearing a droplet mask throughout the facility, even for every patient. We're starting this week wearing mandated eyewear as well for the care of routine patients, and we're also starting a mandatory testing of all of our inpatients that started actually today at the Med Center. So we've got some really great initiatives going on. We are short in a few things. There are some things like, like some of our cleaning equipment, some of our wipes and things like that. I know that is not just at the Med Center, but in other medical communities as well. Those have been kind of hard to come by, things that we use to clean some of our protective equipment and surfaces and things like that. But we're doing okay right now. We're hoping that continues.
I want to jump in here. We just have about 20 seconds, Governor. Memorial Day holiday weekend ahead of us. What's your advice to everybody? Well,
again, Memorial Day holiday, please celebrate, but celebrate with groups of 10 or less. Best practice would be just with your household. And my mom's birthday was yesterday, so happy birthday, Mom.
You got that in there. You just
snuck it right in.
Snuck it right in there. Thanks, Governor. That's all the time we have for tonight. Thanks again to Governor Pete Ricketts for being with us, also for Dr. Angela Hewlett and Felicia Quintana Zen. We appreciate you being here as well. And to the NET crew working behind the scenes to bring this program to you. You can watch tonight's program online at netnebraska.org/coronavirus. You can also send us your questions for next week's live town hall with Governor Ricketts on another special episode of Speaking of Nebraska. That's Thursday night at 8:30 Central on NET, NET Radio, and streaming online. Until then, I'm NET News Director Dennis Kellogg. Thanks for watching.